Good morning and welcome back. Well, November is Lung Cancer Awareness Month, and joining us from Gunderson Health System this morning, Dr. Kurt Oettel. Thanks for waking up with us this morning.
Well, thank you for having me.
We're talking about lung cancer here locally. It's something we hear about all the time, dangers linked to smoking. Locally, do we have any idea of how many people it affects, how prevalent it is in our community?
Well, across the country, there's about 220,000 Americans that are affected with this disease yearly. At Gunderson, we see about 150 cases yearly.
Okay, and as Dustin mentioned, lung cancer always seems to be linked, you think at least, with smoking, but it's not just that, is that correct?
That's correct. Obviously the biggest cause of lung cancer is smoking, but we also know other causes, particularly radon is probably the second most prevalent cause. But unfortunately, there's probably a lot of cancer, lung cancer included, that we really don't have a specific cause. It might be hereditary that we haven't been able to determine yet, but there are a number of cases, yes, that are not caused by smoking.
Okay.
Well, when should people come in and maybe check out the symptoms they're having? When does it start to look like lung cancer, and what are some of the typical warning signs, I guess?
Well, that's one of the unfortunate parts about lung cancer, is that too often patients don't have warning symptoms. Most patients who do come in with, say, a cold, pneumonia. Some people come in after they've coughed up a little bit of blood. But unfortunately, there are no good warning signs, which is why screening has really now started to take off.
Okay, yeah, early screening always helps. And then once you find out that you do have lung cancer, what is there to do to treat it?
Okay, so first off, let me just mention screening. Just recently, over the course of the last couple of years, we've really seen that there is a benefit for screening, particularly with CT, in looking at patients who might be at risk. Right now, that's patients who have a significant smoking history. Once patients do come in and have a diagnosis, it's really treated by multiple individuals. Cancer these days, particularly lung cancer, is not treated by a single individual. Patients are treated by surgery, patients are treated by radiation therapy, or patients are treated by doctors like myself giving chemotherapy, and sometimes all three.
Yeah, just a whole team approach. Now we want to highlight an event coming up tomorrow, November 3rd, at Gunderson, the Shine a Light on Lung Cancer. What's going to be happening, and where can people go for information?
Oh, okay. So Shine a Light is a awareness and it's advocacy looking at this disease. It's at the Ice House. It's put on by Gunderson. 775-6600 is the number to call to get a seat, because I'm told that space is limited.
Okay, so check that out tomorrow night. We'll have more information for that on our website as well.
Please do.
Kurt, thanks so much for joining us.
Thank you.